Bagaetso dumelang thulaganyo e Healthy Living o itlisediwa ke lefapha la boitekanelo mo Kapa Bokone. La me ke Malekau, the man with the Midas touch, and today we are joined by the Chief Director of District Health Services in the Northern Cape, Me Zama Kiti. As we all know that districts are fundamental, they're in the center of implementation of any policies, including the NHI that was signed into law by the president of the country, President Cyril Ramaphosa. Mekiti, good evening and welcome to the show.
Good evening, Malik, and thank you for welcoming me, and good evening to the listeners at home.
Mekiti, to start off and to kick it off, just give us a brief overview of District Health Services and its importance in the Northern Cape.
Thank you for that question, because it is able to assist us to lay a solid ground in terms of how healthcare services in general is rendered and should be rendered. District health services is a vehicle through which to deliver healthcare services using primary health care as a vehicle. And what that means is that it is the most effective and efficient way that is envisaged by the department to be able to render quality of services. It is primarily driven through ensuring that healthcare services is rendered at the most cost-effective manner, at the lowest level of care, which is community-based. And it is premised on the fact that it is cheaper to render healthcare services at a local level as opposed to seeing patients at a hospital level. So hence we say it is cost effective. So it is therefore District Health Services a platform through which to render, the department endeavors to render highest quality of attainable healthcare services in the most effective way, responding to the healthcare needs on the ground.
Now, what has been challenges within districts? I mean, we have 5 districts in the Northern Cape. What has been the key challenges in district health?
Okay, thank you. I think fundamentally it's going to be important to sketch out the different dynamics that district health services finds itself, interacting on. One would be the population that we serve. We have about 1.3 million people in the province, and almost 87% of those are seen through the public health system. So you can already see the pressure that is faced by district health services. So the system is designed in such a way that it has 5 districts, it has 11 district hospitals, it has 33 community health centers, and 161 clinics, and a number of health posts or sites where we are rendering mobile services. What that means, therefore, for us, it means whatever we do, we must endeavor to equitably allocate the resources to serve the 87% of our population. This is, however, compounded by the geographical dynamics of the province. We've got areas that are quite far and which are very rural, affected by the road surfaces, and which then says, in your attempt to ensure that there is equitable allocation of resources, these are all the factors that you have to put into consideration. You will see the variabilities within these 5 districts, that whilst you will have districts that are easily accessible through driving or any other means, there will be those that are very difficult to traverse through. So, however, you'll find that within these districts, you'll find that the one that is the furthest and very difficult to access is the one with the least population. So it calls for a more rationalized approach when you have to attempt to equitably allocate the resource, as opposed to just looking at the population size, because you must factor in how vast the district is and the terrain of the roads and all such things. So it is quite a daunting task, therefore, to have to allocate resources. This is further compounded by the fact that it is almost always difficult to attract resources. In this case, I would want to refer to human resources in these areas that are far-flung, that are very difficult to access, because invariably officials would prefer to be in the urban areas. So as a district health, a public health system, so we have to grapple, with these different dynamics and try and, reconcile these starkly opposing factors and try and converge them to effective healthcare service delivery within the province.
So how do we then mitigate and meander through these challenges to make sure, especially those people that are in Nakop, in the middle of nowhere and with the least population? After all, they do also need healthcare services. So how do we then deal with these type of challenges?
Thank you. As district health services, of course, we shouldn't be losing sight of the fundamental principles that are informing district health services. One of which is access and is responsiveness. So no matter how far-flung the area may be, we need to respond to the burden of disease, to the health needs of the community. Hence, if you listen to when I introduce the different dynamics that I play and the service platform itself, I try to map out areas that we may have to access through the mobile clinics, and we have health posts and we have partnerships, because some of these areas are areas in the farming communities. So we enter into partnerships with farmers who are then able to provide a dedicated space to render healthcare services. But over and above the partnerships, we always have to ensure that there is access through mobile services and also the deployment of these resources. We are assisted by the programs that National has implemented. One of which is community service program. With this community service program, the program was introduced to respond to these dynamics, very difficult dynamics that we have to negotiate as a health sector. So we ensure that these are areas that are covered by these cadres who are deployed through community services, the doctors, the nurses. But over and above that, as a department, through human resource development, we ensure that we do our best to attract nurses from these areas, to train as nurses in our college, so that then they may be able to plow back and go back to serve their communities. These are just some of the ways that we attempt to ensure. Okay, perhaps I must also add that in addition to that, we have different grants, and one of the grant is the NHI grant and the community service grant. Through these grants, we are able to deploy doctors and the much needed healthcare professionals again to these areas. But additionally, we are able to render services through community-based services. We've got a cadre that is called community health workers. It is deployed through ward-based primary healthcare outreach teams. Through this cadre, we use community health workers who are from the communities to serve these communities and are supervised by professional nurses to render healthcare services. I think one needs to say at this stage that district health services is and should be primarily be supported by effective health promotion strategies, because it is much cheaper to prevent ill health than to treat a disease. So we would ordinarily want to ensure that our communities are kept healthy through effective health promotion strategies or interventions.
Now, as we've already illustrated that, there are places that are far, and there are places, and these people really deserve, also are in need of healthcare services. And I must applaud you, in terms of the reaching out to those places because they're the most vulnerable. We'll chat more and continue our discussion after an ad break. Stay tuned on to Healthy Living. We'll take a short break, but don't forget to be part of the conversation. Go to the platforms and leave your questions, leave your comments there, like the page, and engage with the Department of Health so that we can improve from our side. Give us your concerns so that we can address them. We'll be right back after this. Welcome back, and this is Healthy Living on Ncdohtv, brought to you by the Department of Health in the Northern Cape. We are chatting to Zama Kiti, who's the Chief Director for District Health Services in the Northern Cape, and we are looking at the challenges that have been faced by districts in terms of healthcare services and service delivery of therefore, and also we are looking at how better to mitigate through these challenges. And we'll be talking about more the approach in terms of moving forward in the next financial year and the 7th administration. Kitty, welcome back.
Thank you, sir.
What is the plan moving forward in terms of the new leadership in terms of the 7th administration? Is a different approach. It's GNU. What are the plans for district in terms of service delivery in health?
Thank you. Well, we continue to endeavor to render the highest attainable quality of services within the available resources. And in doing this, it is important for us. You mentioned earlier on that NHI is now an act. If it is an act, we are morally obligated as a health system or a health sector to ensure that our communities do have access to healthcare services that they would be proud of, that they will be happy with. So one way of doing this is to ensure that we do continuous assessment of the services that we are rendering through a process called patient experience of care assessment. So we therefore encourage our clients, the communities out there, to be able to participate in this and to score us and really measure our services, because we welcome that. It helps us to be on our toes and to continuously improve the standards of our services. But equally, in an attempt to ensure that we continue to improve, we not only do we train continuously our employees in terms of the ethics and how to render healthcare services and to sharpen their skills, but we also decant our facilities through various strategies, because we have realized that in most cases we congest our facilities by bringing patients that are healthy and are managing themselves well at home, are adhering to their treatment. So we don't want to bring them to the facility just to come and collect treatment. So there is a strategy called CCMDD, which is a strategy that we use to deliver medication to patients at home, or to enable patients to get the medication at the nearest pharmacies next to them. And now we have become quite innovative. There are areas where we are erecting now lockers. We are still trying to get to see what other innovative strategies to ensure that we are able to deliver the medication on the doorstep of the communities, that they don't have to come to the hospital or facility. In doing so, what we seek to achieve is we have as less and less patients coming to our facilities, and we are therefore able to spend quality time with the patient, ensuring that the clinical care that we give to the patient is effective and is addressing the challenges. But we also are rendering school health programs. We go to schools, we go to crèches to ensure that we vaccinate the children, but we do health promotion at schools. We work with Department of Social Development and Education to ensure that the learners at school are healthy and are able to actively participate at school. So in this case, therefore, we would like to encourage communities to actively participate in their health status by keeping themselves healthy, exercising, and ensuring that they take charge of their health. And we encourage them to bring about complaints of where perhaps they think that they've been changed, they were not treated in the manner that they would have loved to be treated. It is important for us to restore trust of the communities to our healthcare services. Thank you.
Is there a challenge of medication in districts?
Oh, there isn't. This is one area where we pride ourselves as a department. We introduced a system called Stock Visibility Program. And this system is a stock visibility system. This system has enabled us to track challenging areas where we are able to see if perhaps through checking our stock levels at the clinic is able to quickly pick up that it seems as if I'm going to run short of a specific item of medication, and to work through the system and see which other facilities still have a good level of stock of that particular item, and we are able to get it, and it gets transferred to the facility that is in need. I'm very confident in this because I attended a ministerial retreat, and we looked into the performance of the province in comparison with other provinces, and we checked and said we saw that we are relatively doing well when it comes to medicine availability in our facilities. Where we would be short of an item, it would almost be an item that we differ on in terms of the strength of that item. Whether if it is Panado, it will be perhaps Panado 500 that we do not have, but we do have Panado 250 milligrams. If therefore we have Panado 250 milligrams, we are able to give 2 boxes of Panado 250, because if you take 2 250s, it is 500 milligrams.
Yeah, that's for those that are a bit dodgy with mathematics. 2 250s, 500. But lastly, what would you like to say to our people of the Northern Cape? And it is interesting that Mekit was saying 87% of our population rely on public health. Mm-hmm. And towards the end of the year, we see that number increasing because Abo Mr. Medical Aids, the medical aid then is exhausted, and they join public health and further add on the stress that public health would have. What would you like to say to multitudes in the Northern Cape?
Oh, thank you for that question. As I said, we really strive to ensure to restore trust of the public in our health systems. So we would love the public to hold us accountable, not only through complaints management or reporting complaints or areas where they have not been treated well, but we would also encourage them to participate in the interventions that I've outlined. There is a strategy that I did not speak to, which is an integrated clinical service management. Through this strategy, we would love our patients, those that we refer to as chronic patients, to really participate in the appointment system, that you can choose to come to the facility at the time that is convenient for you, the date that is convenient for you, so that you do not have to be absent from work and lose your day's wage just because you have to come to the clinic. So we are trying and we are asking that our communities participate and ask the nurses at home to say, but I am a chronic patient. I'm fetching my medication, or I'm coming to see you perhaps once a month or once in 3 months. I would like to choose a time that I will be available, that I may be able to come, that will be convenient for me. If you are working and your clinic is next to town, come to the clinic at a day that is convenient for you, at a time that is convenient for you. Hold us accountable. Demand this. We are at your service. This is what we'd love our communities to hold us accountable on, because this is what we have sworn to as a health center, that we shall deliver highest quality of attainable standards to our communities.
Thank you.
And by participating, it also means taking your medication correctly and on time.
Yes.
Especially those TB ones.
Yes, correctly.
We know what they're doing.
Adhering to medication is very important. And keeping healthy.
Yes.
And living a healthy life, exercising.
Yeah. So let's drink our medication regularly on time. We know that those, especially the TB cases where they're after SASSA disability grant and they default on medication just to be longer on these grants. Is there a system that looks and monitors those type of things?
Oh, thank you for mentioning that. We have had quite a few engagements with SASSA because SASSA have commenced a system of self-enrollment of potential grant members, those that will benefit from the grants. So what then they do is they are able to download from the system, from the SASSA website, the forms, and they enroll themselves. But then they have to come to the facility where they are treated. When they come to the facility where they are treated, we need to assess them and confirm whether they are candidate of grants. So one of the control that we have introduced is to look at your adherence pattern, whether you are adhering with medication, and therefore we reserve a right not to assess you, but to write to SASSA and inform SASSA that no, you are not a candidate for a grant. You need to adhere first to treatment and before you can qualify for a grant.
Megiti, thank you so much for that information. I think our viewers have a much in-depth information on what district health is, which particularly speaks to primary health. Yes. Let's plant vegetables in our yards. Let's go and buy seeds or ask for seeds at a supermarket and plant your vegetables in your yard. Look after them so that we are eating healthy. And it's also cost effective because you don't have to go and buy anything once you've planted them. And let's exercise. Exercising doesn't mean you need to go to a gym where you pay a subscription every month. You can literally do it in your house or outside your yard, or even block walking as friends, and timing yourself and exercising. Let's keep healthy. The responsibility of your health lies squarely on your shoulders. We are just here as the Department of Health to assist you if you fail in your responsibilities. It's been a pleasure speaking to Meki, the Chief Director of District Health Services in the Northern Cape, looking broadly on how we are doing in district health and how to strengthen the primary health. Primary health meaning next to you. Yeah, the first step of the referral process starts at your clinic and elevates up until the tertiary hospital. So let's make sure that we follow that system as well, starting at our clinics, and don't just jump and go to a district hospital. Start at your local facility where you are being helped, because 10 or 9 out of 10, they are able to assist you if you're living healthy in whatever problem or health problems you might have. As we have said with Mr. Ncdohtv in last week's episode, is that we try very hard to make sure that we even reach to those far places of the Northern Cape. With district health services, it's the same ideology to reach you wherever you are. As you've seen, the fleet of the Department of Health within the provinces is not just cars. We have 4x4s. We have these expensive vehicles to make sure that we reach you at home, wherever you are in the province. I'm Malika. This has been Healthy Living on Ncdohtv, brought to you by the Northern Cape Department of Health. I'll see you next week. Bye-bye.